would like to present the situationer. I'd like to start off with our biosurveillance updates, where based on our latest whole genome sequencing results of the 6,589 samples with lineages, we found that 32% or 5,331 of these are positive for Delta, followed by Beta at 21% and then Alpha at almost 19%. If we look at the distribution across time of these variants of concern, where the red shaded bars are the ones pertaining to alpha, beta, and delta variants, nakikita po natin mula doon sa June samples natin where only 4.9% are comprised of delta. Now, in the recent month of October, umabot na po ng 99.8% ang ating lineages samples na positibo po sa Delta. Pero again, ang paalala natin, liban dito sa mga nakaraan nating ginawang sequencing, ang ating paghahanap ng samples or pag-include sa sequencing is targeted. So ito yung isang posibleng dahilan kung bakit napakataas na porsyento ng ating mga nasi-sequence ay nagpapositibo hindi lamang sa Delta, kundi sa iba't ibang mga variants of concern. Patungo naman tayo sa ating case data, where we see aside from a decline in our total reported cases, also a similar decline in our percent active cases, which is now at 1.55% as of November 1. Because of that, nakita natin ang ating recoveries ngayon ay umabot na sa 96.9% at ang ating cumulative case fatality rate ay naiiwan lamang at 1.55%. Again, kung titingnan lang natin among our active cases, slightly tumaas both the number and percentage of our severe and critical, now at 10.16%. And there are two reasons for that. Number one, nakita naman talaga natin na habang dumadami ang kaso, nadadagdagan naman ang ating severe and critical cases. Pero among our active cases, these are the ones who are longest, bago natin sila ma-recover. And it may really take time, bago sila matanggal sa numerong to, kaya tumataas yung prosyenta natin na severe and critical. On the right are the top 5 regions with NCR, Region 2, CAR, Calabarzon, and 3 as regions with the top new cases for November 1, and as to key areas with the highest number of cases reported for November 1. This includes Quezon City, Isabela, Cagayan, Nueva Vizcaya, these three coming from Region 2, and Negros Oriental. Looking now at our epidemic curve, we are just averaging 4,183 cases per day, 14% lower than the average cases we saw the previous week. We noted here ilang porsyento yung nakikita nating pagbaba ng ating average cases per day on a week by week. So makikita natin itong mga naunang linggo ng Oktubre, malaki yung pagbaba. It went down by 26% in the middle of October and then 35% by the end of October. So balit ito yung nababanggit natin na may nakikita tayong pagbagal sa ating pagbaba. It is still going down, but the decline is slower than the previous weeks. And when we look at our table showing our average daily attack rate, our 2-week growth rates, and our utilization rates, we can see that at the national level, we have remained at low risk classification with a negative 2-week growth rate of 49%. At tinitingnan din natin yung ating 1-week growth rate. This is yung nakatala lang po kasi ngayon ay recent 1 to 2 weeks. Nakita natin in the recent 1 week, and comparing it to 2 weeks before, we declined by negative 14%. Mula sa isang high-risk na ADAR, tayo ngayon ay nasa moderate risk ADAR of 4.11 per 100,000 individuals. This low-risk classification is accompanied by an equally low-risk total bed utilization rate of 33.65% and ICU bed utilization rate of 45.18%. Meron na lamang tayong dalawang rehiyon, Regions 2 at CAR, na naiiwan na moderate risk case classification dahil even though there are 2-week growth rates are already negative. Mataas pa po kasi, no? Their ADAR is still above 7 and as such high risk, kaya po moderate risk case classification sila. Napansin din po namin na para po sa CAR, nakapagpakita siya ng bahagyang pagtaas ng kanyang 1-week growth rate. So nag-positive 27% siya in the recent week compared to the previous week. But what we saw for these two areas na naiiwan pang moderate risk ay tuloy-tuloy naman pong pagbaba ng kanilang bed utilization. No? It's now under 60%, pero kailangan pa pong tuloy-tuloy na pababain ang kanilang ICU utilization dahil para sa Region 2, as of October 31, it's at almost 84% at para po sa CAR, it's at 74%. Para naman sa National Capital Region, nanatili rin siyang at low risk case classification with a negative 50% 2-week growth rate and average daily attack rate of 5.97 per 100,000 population. And katulad po ng ating national data, this low case classification is accompanied by low risk bed and ICU bed utilization rates. Pero meron kaming 4 na lugar na fina-flag natin under alert level, 5 lugar na under alert level 4, and these are the areas of Catanduanes, Benguet, Ifugao, Negros Oriental, and the city of Santiago in Region 2. Sa ngayon, sa 5 lugar na to, ang Catanduanes ay naka-high risk case classification, while the 4 other areas are at moderate risk case classification. Pero mapapansin natin na ang mga lugar na to ay merong either a high risk bed utilization or ICU utilization, or para sa mga probinsya ng Benguet, Negros Oriental, and the city of Santiago, both its total bed and ICU bed utilizations are at high risk. Looking at the National Capital Region, our average cases per day is now at 770. Much like the national data, it went down by 14%. At ito ay nakakita din tayo na parang sa national, no, the decline is continuous but it is slower than the previous weeks. But this decline in cases is also accompanied, no, by a decline in our admissions. So this graph is showing our admissions, where the blue bars are the admissions and the gray bars are the total beds. So pinapakita doon sa table sa taas, ano yung datos natin nung simula ng Hulyo, where we have the among the smallest number of cases, at as of November 1. Makikita natin we're now at a lower total bed utilization rate of 30% versus the 36% in July 1. At ang dahilan nun ay dalawa. No? Una, naiiwang mataas pa yung numero ng kama na na-dedicate natin sa COVID. No? We're at around 8,900 as of November 1, and this is higher than the 8,153 dedicated last July. But we also saw that the number being admitted as of November 1 is much lower. No? It's only 3,100 versus the 3,362 noong Hulyo. Pero yung aming pag-iingat or yung ating caution palagi is our ICU, no, and our critical care capacity. Sa ngayon, comparing July 1 to November 1, the ICU bed utilization rate is the same at 40%. So balit, nakikita natin na mas marami pa rin kama, no, na naiiwan, na nakadedicate para sa COVID, no, ang mga ICU bed. At sapat na nadededicate ito dahil medyo mas marami pa po, no? Yung naiiwang naka-admit at 558 versus the 450 na nakita natin nung Hulyo. Ito yung sinasabi natin na even though cases are going down, we need to only gradually, no, i-face natin ang pagbaba ng ating mga kama para hindi siya maka-apekto doon sa ating mga utilization rates. Looking at our mortality, we see a more continuous, no, and a rapid decline also in our deaths. We're only averaging 73 deaths as of the end of October versus the highest average natin nitong Augusto at 174 deaths per day. I'd like to now share briefly what we saw, no, in the recent projections done by a sub-technical working group on data analytics in our PASTOR team. So bago ko pala ipakita, ang mga ginagamit natin dito para sa projections, nagagawa tayo ng mga scenarios, no? Para dito, para ma-generate ng scenarios, tinitingnan natin una yung mobility ng mga lugar. Ikalawa, ano yung vaccination coverage? Ikatlo, ano yung health system capacity o yung bilis mula nang ikaw ay ma-detect hanggang ikaw ay ma-isolate. At ikaapat, no, ano yung adherence or compliance natin to the minimum public health standards. And with the combination of these assumptions, ano ba yung magiging trajectory ng ating datos? So, sisimulan ko po no, in our Philippine data. So kung mapapansin po natin, parang merong three major na parang lines na lumalabas. We have this solid line of violet and red na tuloy-tuloy na bumababa. Meron tayong yellow line na unti-unti ang pagtaas, and this red line no na mas mabilis ang pagtaas na nakikita po natin. So itong senaryo kung saan nakakakita tayo ng pagtaas ay yung mga senaryo kung saan ang ating mobility ay tumataas at sinasabayan siya ng pag-worsen ng ating minimum public health standards. Nakikita naman natin, no, habang tayo ay nagbubukas ng ating mga sektor, marami tayong mas lalabas sa mga tao. And with mobility, we're observing a decline in our adherence to MPHS, not just the masking, but of course, physical distancing. And because we are becoming more mobile, mas nagiging crowded no, ang mga lugar natin. So, but in the scenarios where we see a continuous decline no in our case data, ito yung mga senaryo kung saan posibleng bumilis o tumaas pa yung mobility natin pero naiwan na mabilis ang paghahanap natin at pag-isolate ng mga kaso. Naiwan na maganda yung compliance natin to minimum public health standards. Tayo ay nagbibigay ng projections na ito dahil katatapos lamang po no, ng isang major holiday, and there will be more holidays coming up and Christmas is around the corner. So while we cannot prevent people becoming more mobile, we need our communities to ensure na ang pagsunod natin sa ating MPHS ay maging stricto at isa pang assumption na banggit ko dito ay ang ating vaccination coverage. Isa siya sa makakatulong para tuloy-tuloy na mapababa ang kaso. So as of December 15, our numbers can actually range from as low as 2,139 active cases if our mobility is maintained, if our MPHS we continue to be adherent no, to our MPHS, even with current or improved vaccination and with good case detection to isolation intervals, it can be as low as this. However, kung ang ating pagiging mas mobile ay sasabayan ng pagbaba ng ating adherence to minimum public health standards at babagal na naman ang paghahanap at pag-isolate natin ng kaso, from just 2,100, posibleng umakyat ang mga active cases natin to 49 to 52,000 as of December 15. And that's for Philippines. Ngayon, tingnan natin sa National Capital Region. Dito, hindi siguro kasing taas no, yung nakikita nating upward trend as the national data. Kaya lamang yung scenario na to, yung dashed lines na to na red at yung dashed lines na violet is also pertaining to a scenario where the increase in mobility is coupled with a decline in our minimum public health standards and a worsening of our health system capacity or bumabagal na naman no, yung ating paghahanap at pag-isolate ng kaso. Hindi na isang napakalaki, hindi na ganong kalaki yung epekto ng vaccination sa NCR dahil isa siya sa mga rehiyon na naka-achieve no, ng very high fully vaccinated coverage. At ang mga nakita nating senaryo na pwede ngang mag-apekto ng numero ay ito, mobility, adherence to MPHS, and how soon and how fast do we detect and isolate numbers. So as of December, our numbers can be as low as 1,035 but can reach 3,535 again if the increase in mobility is coupled with declines in our minimum public health standards adherence, at ikalawa, kapag babagal na naman po ang ating detect to isolate na intervals po. So I'd like to end this situationer with these 4 key messages. Number 1, we saw our areas under alert level 4 decline to just 5 or 4% of our provinces, HUCs, and ICCs, while the majority are now under alert level 2. Pero yun nga, bagkus tayo nakakakita ng tuloy-tuloy na pagbaba ng kaso nationally and at NCR, ang pagbaba na to ay bumabagal, no? At meron nga tayong 3 rehiyon nakakita ng bahagyang pagtaas, no, ng kanilang mga kaso nitong nakaraang linggo. Inililista lamang namin dito ang mga bagay na posibleng maging dahilan upang dumami na naman ang ating kaso. At yun nga ay ang pagiging mas mobile, ang tuloy-tuloy na transmission ng ating mga variants of concern, at yung mga delays, no, ng ating case finding or surveillance and isolation. Kaya lamang nakikita naman natin na base sa mga projections na to, pwedeng mamitigate ang pagiging mas mobile, no, by ensuring that we continue to increase our vaccination coverage, at ikalawa, that we ensure, no, that our adherence to MPHS is maintained. So, salamat and good morning.
Thank you very much po, Director Thea. Now we move on to the open forum. But before we proceed, we would just like to reiterate that we would only kindly limit your questions to 2 lang. And if there are any clarificatory questions, we can have another round for that. And so we begin with Red.
Hi po, good morning po, Doctor. Good morning. Good afternoon, Dr. Thea. Dr. Thea, i-encapsulate ko na to in just 2 short questions. Number 1, many experts are saying na dapat hindi tayo maging complacent. So we should not be too complacent. With the figures that you presented to us right now, doon sa FASTER and data analytics graph, and of course with your participation in the IATF meetings, are our authorities confident na hindi sila magiging complacent, specifically dito sa NCR? Kasi we know na masyado ng mobile ang tao ngayon, napakadami ng gumagala ngayon. So how are we confident na hindi magiging complacent ang tao, especially now nga na we are now approaching November and December, kung saan napakadami ng tao na gumagala talaga?
Okay, thank you, Red. So when we presented these projections to IATF, no, it was well received naman, no. They understood it, and I think that has been our message ever since, no, na kailangan it's not just one thing that we can do. It should be a combination of interventions to push case numbers down. And natututo naman tayo na sa experience nga natin na kailangan masustain to. And that means really continuing the interventions that we had. And we can't let loose, no? Or parang kailangan masustain yung gains naman natin. Kaya naman ang paghahanda natin, ngayon ay Nobyembre pa lamang. Pero ngayon pa lang, andito na nga ang Department of Health na nagpapaalala na of course, we want our sectors to open up. But we want people to be aware that, you know, as our sectors open up, we want it to be safe. No? So natin, protektado, hindi lamang at the individual level, we want also protection at our establishment, no, in our workplace levels. No? Ikalawa, kung natatandaan natin, no, last year we had the same cautions, no, and advisories to the public because we don't want to see what we call a post-holiday increase in cases. There was a slight increase in cases last year, no? Pagkatapos nung immediately following New Year, mayroon tayong konting pagtaas na nakita, pero hindi siya tulad ng nakita natin sa ibang bansa. At sa tingin ko, ito ay dahil tayo ay nakapagbigay, no, ng advisory agad at ang ating publiko ay nakinig naman, no, kasi we all want this opening up to be sustained, no, at gusto natin at hindi lamang sa sustain siya pero talagang nakakasiguro, no, we're confident that we're safely opening up. And I think this is a very good way nga para sa para mapaabot sa publiko na kailangan nating gawin to, no? We don't want to keep opening and closing sectors. Gusto natin pag nagbukas tayo, pag bumaba tayo ng alert level, bumaba siya, no? Maiwan siyang bumaba at tuloy-tuloy siyang bumaba. Pero it really requires participation not just from government, but also from our establishments and especially, no, yung individual person na kailangan mag-practice ng ating NPHS programs. I hope I was able to answer you then.
Yes. And last question, siguro the elephant in the room. Ito po bang projections natin na to are already indicative that we could be going into alert level 2 by November 15? Yun lang po.
I think natanong nga yan previously, no? Pero much like I think Yusek Rosette relate, what the sub-technical working group does is to analyze data, and it will be tackled, no, and reviewed under our IATF. So as soon as this has been discussed in IATF, we'll see, no, kung ano yung magiging decision, and that will be announced by our spokesperson.
Okay po. Salamat po, Dr. Ya. Salamat, Tina.
You're welcome.
Thank you, Red. Thank you, Dr. Next, we'll have Lay Alvis.
Good afternoon po, Doc. Doc, ano po yung implication ng slower decline in cases nationwide and in NCR? Does this mean na pwedeng after the decline, tumaas na po ulit yung mga new cases?
Well, yes, Lino, that's one. No? Kaya tayo pa-flag na, dati 36%, 26%, ngayon nakakakita tayo ng 14%. Well, una, good news pa rin naman yun, no? There is a decline. Pero pag bumabagal nga, tama ka, yun ay higit nating binabantayan kasi yung pagbagal na yun, posibleng makita natin from a negative, nagpa-positive tayo. So, and I guess, isa rin itong kaya yung isang call namin ay kailangan yung tuloy-tuloy na paghahanap ng kaso. Palagi kong nababanggit na in surveillance, no, in case detection, when cases go down, this is the opportunity for us to intensify the active case finding kasi we want to be able to prove na kapag mababa ang kaso, talagang mababa ang kaso, wala tayong nami-miss out na mga cases, at ikalawa, lalo na dun sa mga lugar na zero na lang or isa na lang ang kaso, ay yung masabi talaga natin na talagang walang kaso even though we have enhanced our active case finding.
Second question po, Doc. Sa NCR, yung ADAR po is around 5 point something po. And last time, sabi po ni Yusek Perhere, kapag 7 or below ang ADAR, pwede nang mag-shift to alert level 2. Is this the case po for NCR?
The process right now is we review the metrics o yung datos natin, Lee. Tapos yan, nagkakaroon ng meeting para pag-usapan yan on the sub-technical working group. And then it's recommended, no, to our IATF. Right now, while we do weekly assessments of our alert level, the announcements or changes in our alert levels happen every 2 weeks. So isa to sa mga pag-uusapan sa susunod na IATF.
Thank you po, Doc.
Thank you.
Thank you, Lay. Thank you, Director Thea. For the next question, we'll have Caroline.
Good morning po, Dr. Thea. Ma'am, tatanong ko lang po sana, kasi mababa pa yung vaccine coverage sa ibang regions. May impact po ba yon kung bakit yung ibang areas nasa high or moderate risk category?
Yeah. Thank you, Caroline. Magandang tanong yan, no? Kung titingnan natin yung formula na madalas nang kita kung bakit dumadami ang kaso, vaccination is just one reason, no? Or parang one factor that could lead to a slowdown, that can lead to a higher number of cases or a lower number of cases. And while some areas actually have lower vaccination coverages, nakita naman natin bumababa pa rin, no, yung kanilang kaso. And much of that is because we really enhanced how we found cases, we improve on our isolation, And we couple that with better referral systems, kaya pati yung deaths natin bumababa. Sa ngayon, ang ating strategy ay on top of increasing vaccination coverage, kailangan yung ibang mga nabanggit ko, the other PDIPR should be there din. No? Remember, the vaccination is here to protect us from severe and critical disease and from fatalities. Right now, what can push case numbers down will really be the other strategies natin, which is the us being compliant to minimum public health standards, and the LGUs continuing their efforts on our detect, isolate, and treat strategies.
Ma'am, and then based po dun sa pinakita nyong projection ng National Capital Region, this is a scenario for alert level 3. Pero ma'am, meron ba tayong projection kung ilan yung possible cases by this November and December kung mag-shift tayo sa alert level 2, and ilang % po yung mobility nun, if ever?
Okay. Dito thank you, an interesting question. No? So, kung makikita natin, ang na-include sa ating scenario ay wala tayong nabanggit kung anong alert level siya. Wala kasi tayong historical data na magsasabi na kapag alert level 3, ito ang mobility ko, or kung alert level 2, ito ang mobility. Ito yung magiging mobility ng isang lugar. Ngayon lang natin makikita kung anong epekto ng mga alert levels on our mobility. Kaya ang pinakita natin doon is paano kung ngayon tayo ay 71% as mobile versus yung pre-pandemic levels natin, we're assuming na paano kung bumaba nga at tuloy-tuloy na bumaba ang alert levels at umabot tayo ng 91% of our pre-pandemic levels, ano yung magiging numero natin. So I think that's the closest, or parang the best way for us to assume kung ano yung posibleng mobility at ano yung mga posibleng numero if we go down on a certain alert level, and if a certain alert level ay translate to a higher mobility. And I think yung highest na ginamit namin doon is 91% mobility in comparison to the pre-pandemic level.
At pwede po mag-clarify ng isa lang?
We'll just have another round for clarificatory questions, Caroline, if that's okay. Para lang ma-accommodate natin lahat ng questions.
Okay, thank you.
Sorry, thank you. Next, we'll have Rafael Bosano.
Hi Doc, i-clarify ko lang po yung projections din sa NCR kasi nakalagay po by December 15 concurrent yung MPHS nasa 1,035. So parang ito yung best case scenario natin, di ba ma'am? Pero so does this mean it's also safe to assume na by around that time, tataas talaga yung cases ulit sa NCR kasi ngayon we're just seeing 700 average daily cases?
Ayun. Magandang tanong yan, Rafael. These projections were done a week ago, no? Siguro medyo technical siya, pero yung unang parte ng projection ko napansin nyo, naka-fit siya kung ano yung mukha ng ating mga kaso talaga ng actual cases. Tapos magda-diverge na siya. Depende kung ano yung mga naging assumptions. So para siya, ngayon nakita natin na from the number we saw 1 week ago, ito yung bagong numero. So anong gusto ko sabihin? Hindi sa pataas na tayo, kung kumbaga base doon sa datos natin last time na, yung mga datos na ginamit natin a week ago para sa ating projections, ito yung pinakikita niya. Pero posible dahil ang numero naman natin ay tuloy-tuloy ngang bumababa, kung siya ay uulitin natin ngayon, posibleng iba na yung magiging projections natin. Posibleng from 1,000, it might be a bit lower already kasi our numbers continued to decline. And I think that's the reason why we always say na, in these projections, we're seeing that there's a range of 1,000 to as high as 3,000. But actually, since it was based on data a week ago, kung titingnan ko siya ngayon, it might be different. We might be in a better position now than what our projections are showing because either we did better on any of the assumptions, we weren't as mobile, our adherence were better. We were able to maintain or improve on our detect to isolate level. So siguro yung isa sa ginagawa natin ay ulitin ang mga projections na to para makumpara, no? Tayo ba ay katulad ng una natin projections or mas bumababa na yung projections base doon sa pinakabagong data. I hope nasagot kita, Rafael.
Opo, sige po, active tsaka nga po pala active cases po siya.
Active
Then,
cases naman siya.
opo. And then, yung isang question po, ma'am, since mas marami na pong mga lugar, no, and regions ang nasa lower levels na yung kanilang health systems capacity, paano po mangyayari dun sa, i-maintain po ba yung bed capacity na inallocate halimbawa ng isang hospital? Kasi during the surge or during the times when cases were rising, talagang inutusan yung mga hospital to allocate more beds, and some even converted yung kanilang non-COVID to COVID beds. So with the improvement, i-maintain po ba yan? And if i-maintain po yan, paano naman po yung mga non-COVID na ginawang COVID, makaka-accommodate pa rin ba sila ng mga non-COVID patients? Won't there be a problem with that, ma'am?
Tama, no, Rafael, no? So even in the middle of this pandemic, napakahalaga yung pagbabalanse na tayo ay nakakapagbigay ng magandang kalidad ng serbisyo sa ating COVID-19 pero not at the expense, no, of our non-COVID admissions. Sa ngayon, kapag tayo ay umaabot, no, to that sudden increase in cases, ang mga hospital natin, no, ang government hospitals, for example, can increase their allocated beds to as high as 50%. Pero sabihin na natin in normal or in times na hindi naman tumataas ang kaso at nakikita natin ang tuloy-tuloy na pagbaba ng kaso, yun ay pwedeng ibaba ulit, no? To as low as 30% of their hospitals. Ang ating mga facilities ay nabigyan naman na ng guidance na kapag na-observe naman nila, tulad ng pinakita nating graph na tayo ay tuloy-tuloy na nakakapagpababa ng ating admissions, they can also slowly, no, transition their COVID to non-COVID beds. Pero kung nakakakita ang ating mga health facility ng bigla ang pagdami ng admission, it needs to be agile, no? It needs to be flexible na, tumataas na naman. So kailangan yung dati siguro na tinanggal ko na ay ibalik ko na ulit to ensure that my utilization rates will remain at a lower rate.
Thank you, Doc.
Thank you, Rafael, and thank you, Director Thea. Before we continue, may I just remind our media partners to, if ever yung question nyo could be short and concise para ma-accommodate pa rin natin yung mga ibang follow-up questions. Next up, we'll have JC Cosico.
Doc, just for the soundbite, you mentioned earlier decreasing in deaths in the country. Ano po yung pinaka-reason bakit po bababa yung mga namamatay po sa COVID? Thank you.
Okay. Nakikita natin, no, ang mga major factors that contribute to declines in our deaths are: number one, we have increasing vaccination coverage. Ikalawa, improvements, no, in our health system capacity. Malaki ang dinami ng mga kama, lalo na mga ICU bed para sa COVID, at na-improve, no, yung ating referral systems and triage systems such that we are able to appropriately refer the moderate, severe, and critical to our health facilities, while those with mild or symptomatic diseases are in community isolation facilities.
Tapos last, ma'am, yung profile na lang po ng mga namamatay, ma'am, mayroon bang update na, ma'am?
I don't think I have that in my slide, but the profile remains the same, no? It's still the older age group and those with comorbidities comprising majority of our deaths, no? Pero kung I'm not sure, Rina, no, but I think Yosek Rosette showed previously na while parang pareho pa rin yung mas nagko-contribute, no, to our deaths, nakikita din naman natin, no, na yung case fatalities, no, among these older age groups were no, na parang na-cut siya in half if I compare 2020 to 2021. So right now, kaya nandun yung ating pagpapaalala na number one, kailangan talaga makapagpabakuna at mataas natin ang vaccination coverage ng ating elderly and with comorbidities. At yung nabanggit ko kanina, we really need to be to have ourselves checked, kung tayo naging symptomatic, lalo na kung alam mong nasa vulnerable population ka, magpatingin ka agad, At kung alam mo na ikaw ay nakakaroon na ng warning signs and symptoms, magpa-admit ka agad, para masigurado natin yung agaran and appropriate na treatment, sa ating mga severe, moderate, and critical cases.
Thank you, Doc.
Thank you, JC, and thank you, Director Thea. Catherine Gonzalez.
Hi, Doc. Good afternoon. Ma'am, just one question po about sa slower decline of cases nationwide and in Metro Manila. May specific reason po ba tayo na tinitignan for this observation? Is this also about the mobility pa din po?
Bakit mas mabagal yung pagbaba ng kaso? Sa tingin ko yung kailangan i-konteksta doon, hindi naman tumataas yung kaso. Pababa pa rin siya. Hindi na nga lang siya at the same rate as the one we're observing previously. Yung isa sa posibleng dahilan ay habang bumababa ang kaso, minsan meron tayong mga areas na medyo nag-ease up at their active case finding. Kaya tayo ay nagpapaalala nga yung call natin na kailangan tuloy-tuloy yung active case finding natin para when we see this decline slowing down, we can tell them na, this is okay, na the cases are still going down, though it's a little bit slower, pero I can say that's still a true decline, a continuous decline, kasi yung ating paghahanap ng kaso ay tuloy-tuloy naman. So, isa yun sa kailangang alamin din namin, at pinag-aaralan natin kung paano natin maa-address yung decline. Pero sa tingin ko for now, it's good that it's still a decline, but yeah, we still need to intensify our efforts ng ating PBIPR.
Thank you po.
Thank you, Catherine. Thank you rin ulit, Dr. Thea. Aiko Miguel.
Yes po, Doc. Good afternoon po. Doc, sabi po ng Okta, one of the reasons why NCR should de-escalate to alert level 2 by mid-November is because there's no new variant threat. But with the situation that we are in now po, Doc Thea, can we still say that recorded cases are variant-driven, or are there still Delta cases which are active po?
Okay. I'm not sure as to the relationship of the presence of a variant of concern to our alert levels. Ang alert level po na sa pagpapaliwanag nga ni Yusek Baset is a cross-tabulation of our case data and our utilization data. At alam naman natin na ang kaso natin, hindi lamang siya driven ng ating variants of concern. Nakita natin na as of October, almost 99%, 99% of the sequences that we have, the samples we have sequenced are Delta. Pero bakit tuloy-tuloy pa rin na bumababa ang kaso natin? So the variance of concern is just one factor. Pero ang pinakamalaking factor talaga na gusto nating matingnan sa pag-de-escalate natin ng alert level is for them to be able to maintain that lower case classification as well as maintaining a lower utilization rate. And again, as I mentioned, ito naman ay pinag-aaralan natin under for assessment naman na talaga si National Capital Region, at isa siya sa pag-uusapan at pagdedesisyonan ng ating IETF sa susunod na meeting natin.
Ma'am, follow-up lang po yung Delta cases which are still active. Meron po ba tayo?
Yeah. Sa ngayon, meron tayo mga bagong na-report na kaso ng Delta. Pero sabi nga natin, as long as these cases have been detected and they are actually based on the data that we have, they have actually been isolated agad naman. And even those that we found weeks later or after their recovery, nakita natin na sila naman ay nakapagkumpleto ng kanilang mga quarantino or ng kanilang mga isolation. So, yun yung isang malaking factor, nahanap sila agad. At even though meron tayong continuing Delta transmission dahil nahanap sila agad at na-isolate sila agad, isa to sa mga factors kung bakit tayo ay tuloy-tuloy pa rin naman, no, na nakakakita ng pagbaba ng kaso nationally and even at an NCR level.
Thank you po, Dr. Tia.
Welcome.
Thank you, Aiko. We'll now entertain clarification po from Caroline Bonkin.
Ma'am, regarding po dun sa NCR projection, ma'am, just to clarify, yun pong number 1 and 2, ito po yung current alert level 3 na mobility natin. And then if we go to alert level 2, most likely this will be number 3 and 4 po ba?
Okay. Tinitingnan ko yung mobility natin ngayon. The 82%, yes, that's the current mobility natin. Pero remember, no, parang kombinasyon na siya ng nag-alert level 3, 4 to 3 tayo, no. The others, yung nilagay natin, no, na umakyat siya ng 91%, we're trying to approximate or estimate what would be the alert level or what would be the mobility, not just if we were at alert level 2, but what if we reach a point, no, bababa na tayo sa alert level 1, no? So sa ngayon, hindi namin kasi ma-estima talaga what will be that mobility, again, because we don't have historical data of alert level mobility. But parang ito yung nakikita namin na baka pinakamataas na nating mobility, whether it's alert level 2 or alert level 1 by November and December.
Ma'am, sorry, saan po yung 82? Dito po kasi sa table 68.5, 76 to 90.
I'm looking at the Philippines. Sorry. So 68.5. Yeah, tama. Sorry. I apologize. So sa NCR, our current is at almost 69%. And then dalawa yung assumption namin pala. Sorry. I was talking about the Philippines earlier. It can go as high as 90%. That's the first assumption. Or it can be even higher at 95%. Thank you, Caroline, for clarifying.
Thank you, Caroline. Doc Tia, quick question lang po from Christian Deparin. From Dr. Tia's slide earlier, it showed that the Delta variant now accounts for 32.14% or 5,331 cases of the samples with lineages. May additional variant cases po ba tayo? In USEC RSV's slide on October 25, it showed only 30.29% or 4,811 Delta cases.
Yes. Now, in our most recent whole genome sequencing, we were able to detect additional variant of concern cases. No, I don't think I included that already, but we had an additional 520 Delta cases, an additional 83 beta, and 64 alpha variant of concern.
Thank you po, Director Tia. Lay Alvis, for the last clarification, please. Thank you.
Doc, clarify ko lang po, nabanggit niyo po kanina may 5 areas na natitira sa alert level 4. Ano po ito, no? Hindi naman po lahat po ng areas sa bansa pa ay under the alert level system.
Tama ka. Sa ngayon, ginagamit namin, no, yung alert level, parang there are 2 ways we describe it. We want to be able to describe all the areas now under the alert level system. Pero ang mga expansion ng ating alert level system ay nasa NCR, nasa Region 3, Region 4, 6, 7, 10, and 11 pa lamang, no? So yung mga ibang lugar dito na nilista namin na nasa alert level 4, hindi pa nila ginagamit, no, yung alert level system natin. Sila ay under a certain community quarantine classification pa rin. At I'm just going through the list. So dito, I think only the Negros Oriental, no, pa lamang yung nasa alert level system natin.
Thank you po, Dr. Tia.
Thank you, Lay. Thank you, Director Tia, for accommodating our request for today. To formally end our Kapihan session today, Dr. Tia, would you have any quick and short final message to our media partners and to all our viewers on Facebook?
Una, tayo naman ay natutuwa, no? Nakakakita nga tayo ng tuloy-tuloy na pagbaba, hindi lamang ng ating dami ng kaso, pero even in our admissions, both total and ICU. Pero ang Department of Health ay nagpapaalala na we need to be able to sustain our gains. No? We need to be able to not just safely, but continuously open our sectors, no? Para it will, and that can be done by ensuring that our compliance to MPHS is still there. We need to seek consultation early para tayo ay mahanap at ma-isolate agad. At yung pinakahuli ay ang pagpapabakunan. No? So yung lalo na sa ating mga elderly, lalo na sa ating mga persons with comorbidities and other vulnerable population, please get yourself vaccinated and let's get ourselves protected, no? And that is really one major factor that will not just ensure cases go down, but ensuring also that our fatalities continue to go down. So yun lamang, keep safe everyone, and thank you very much.
Maraming salamat po ulit, Director Thea, and to all our media partners in the call, maraming salamat po. And have a